It is very debilitating for anybody selling into a company with the current model of the way companies make decisions on health plan offerings and wellness offerings. There is a drum roll, which is regrettably used too often, which is that there's a 3-month period early in the year when vendors come in. There's a 3 to 4 month period when the vendors are evaluated and companies decide that they're going to do 2 initiatives for the year. Then there's an open enrollment period with an elaborate amount of communication, usually uniform, not tailored. And then there's taking a breather around the holidays. But there's no ongoing communication, number one. Number two, there is very often a one-size-fits-all kind of communication, but there's an open enrollment rhythm, which companies have used forever, which is really probably worked in the 1980s, but doesn't work anymore. So let's go to the facts here, and you'll see a very different approach that is needed. And you'll see 2 things here that stand out: multi-year, reaching employees across the spectrum and continuum. And I would also add a concept of continuous interaction on health and well-being. I can turn it over to you, Ray, or to you, Mark, however you want to proceed here.
Mark, why don't you go ahead?
Okay. I mean, I think one of the things that, from my experience working at sort of some large multinationals sort of driving cultures of health was really this it was one of the biggest challenges was, how do you sort of measure health of your organization and sort of translate that into sort of business metrics? And it used to often be that they'd capture some data at the end of the year and that would be it. And if it had gone in the right direction, then they were, everyone was patting themselves on the back and saying what a great job they'd done. If it stayed flat or gone down or changed in the negative, there was generally some excuses why that had happened. But without, and just looking at it once a year just really didn't work. So what we really found was trying to get data and metrics that you can put in front of business leaders on a regular basis, quarterly at least, but even sometimes more frequently than that. And the data needs to be not just, number of people seen in the clinic or number of blood pressures taken. It really needs to be translated in what's that meaning for the organization in terms of driving success. And this is still probably one of the more difficult areas for organizations to get your head around, because, health doesn't change that quickly. But the culture can systematically change over time. So if you can measure that culture, you can sort of have that metric that sort of says, we're moving towards the place, we know in the direction we're going, and we know if we're getting better or not. So I think data is really important. And if you can get it onto a sort of business dashboard, and I know at my last sort of major organization, they used to have metrics that were up on that sort of executive team dashboard that included a health metric that was in there. They set goals, they reported them externally. They said if they didn't meet them, they said why, and if we exceeded them, we said why as well. And that was really important, that the business leaders owned those metrics. It wasn't the health department or the HR department. It was the business leaders that owned those metrics. And if they didn't go well in certain parts of the organization, there's always a spectrum, and we sort of color coded them. So so if it was red, gets attention of business leaders. If it's green, everyone feels better. But it was that directional, knowing where you're going, rather than sometimes, absolute numbers, absolute sort of data points of saying, where now our healthcare spend has gone down, which obviously you want to track. But sometimes just having that sort of directional metric is easier to put in place, and something that you can get business leaders to get their heads around and to own. If they don't really understand the metric, they're never going to own the drivers behind it as well. So I still think this is one of the more challenging areas to do. But I think, there are tools and things out there which can help develop that and track progress over time, which I think is really important. So hand back to you, Ray.
Yeah, beautifully said. To build on your comments with 2 words, operational excellence, I think is important. during my tenure as the global medical leader at General Electric, we were required as all leaders of all departments of the organization to have a continuously evaluated and improving multi-year strategic plan. And so as my company HealthNEXT has studied benchmark culture of health companies, one of the hallmarks is that they know what they're doing as it relates to health and well-being in 2025. I mean, they know what they're going to do this year, they know what they're going to do next year, and they know what they're going to do at least 3 years out. And the reason for that, as Mark commented, is that building a culture takes time, and markedly impacting the illness burden and health of a population takes time. And what we have found with benchmark culture of health and well-being companies that have a multi-year strategic plan that reaches employees across the population health and well-being continuum is that first you see that the illness burden and aggregate risk of the population covered and the workforce stabilizes and stops going up. We know from research done from my mentor and great friend who I miss very much because he's recently passed away, Dee Eddington's research out of the University of Michigan shows that populations generally get 2 to 4% sicker every year if you're not doing anything. And that is a major contributor to our first fact, which is this relentless escalation of healthcare costs. If we don't do everything we can to stem that tide, a shame on us. Ultimately, even economists believe that this can be a tremendous threat to American enterprise as Americans get worse. Each generation, they get there's more chronic illness, and over the years, they're getting sicker at a rate that we can mitigate. And so the first thing that happens when you start to build a culture of health and well-being in a corporation is you start to see that chronic illness prevalence stabilizes before it goes down, and aggregate risks, health risks, also stabilizes before they go down. But it's a day to celebrate when employers can demonstrate that their workforce is no more ill in 2023 than it was in 2022. And it is possible. And one of the ways that it's possible is by developing a thoughtful multi-year strategic plan.
Yeah, I just want to make one final comment here. Mark made a comment about how do you define success? It's not just whether you put programs out there, but who's using them, how actively they're using them. Reaching employees, getting that right in terms of reaching a large part of the population, engaging with them, is what makes this strategic plan work, as opposed to just putting up programs that very few people use except the already motivated.